Hi, how are you guys? We're going to talk today about something that some people call porokeratosis, some people call a nucleated wart or a seed wart, something to that nature that actually is on the bottom of the foot. So, come on over, let's take a look at it together. So, basically, the skin is made out of two layers there is the epidermis, and then there's the dermis. Now, in the dermis layer is where living things are. The epidermis is kind of like a basal cell layer that gives out the 5 layers of the epidermis, and then we have the stratum corneum that sheds off. But in our skin, especially on the bottom of the foot, we have a lot of sweat glands that are sitting around, and those sweat glands, the blood comes into them and it filtrates the sweat out, and the sweat then comes out in a duct, and that duct goes out to the layer of the skin outside like this. So now we have a duct and we have a system, and then we have the blood supply to them, and then what happens is you get this little hole that you can see if you have a microscope and you're looking at your skin, that comes out to your skin. So now you're walking on this and it looks like this, and that's the sweat gland. This is the bottom of the foot right there. Anyway, so basically this layer here is the problem. This is the layer that gets the problem. So now what happens is if you have let's move this over this way because that's where we're going to walk on. There is the big bone here that's coming down on that area, let's say a fifth metatarsal or something like that. And that pressurizes this skin layer. And as it does that, the skin layer here then does not have the ability of shedding. And as it doesn't have the ability of shedding, it accumulates internally into a crevice, and that crevice is the hole right here. And as that happens in time, what's going to happen is this here will migrate right into this, and it'll migrate into it, and then it plugs it up. And a lot of patients come in with severe pain because this here becomes accumulated of sweat, that it becomes very large and it becomes very red. So on the outside you'll see redness, you'll see what you see here is kind of like a concentric circles. So if you look at this from a different point of view, from top view, it'll be like this is the skin lines. Normally that's how they look like, and then there's like holes in it, that those are the sweat gland pores. But with a poro or a seed wart, what happens is you get this accumulation and you get this configuration, which is the concentric circling, because then you see the inside, the outside, and so on and so forth. That has many treatment options, but I just wanted to show you how the pathogenesis is.